someone returning to their home community with new functional needs, levels of impairment that they did not have before, things like accessibility, mobility, and function. The impact seems to be greater in many small rural communities because the infrastructure just isn't there, right? In a large urban center, and it's not to say these things are easy to access, but more resources and supports exist. The accessibility of them, that maybe is a different conversation, but they are there. Whereas in our small rural communities, oftentimes they just aren't there, and they're very hard to get or access. So there's a fair bit of problem solving that needs to happen, quite a bit of creativity. If we want to support Albertans, well, then we have to recognize, yeah, there's a difference between Edmonton and Calgary, but then there's also a difference between Edmonton, Calgary, and the geography in between. And there's a difference between that and rural north, and there's a difference with rural south. So we need that kind of representation. I think we need to think about, with spinal cord injury in particular, right? And we would do this with any patient population. We need to think about that person's journey, right? From where did injury start, right? For some people it's congenital, for some people it's acquired at some point in their life. So we need to have people with experience in that phase, right? Whether it's people with lived experience or the people that are involved with working with that population. And then throughout that experience, right? The inpatient experience, the community-based experience, the long-term rehab experience, and as we start to think about the other topics that we want to explore and support, well, then we think, well, do we have representation from those areas, right? Like community-based living, recreation. As a physiotherapist, it's like, yeah, I'm the guy to talk to if we want to talk about inpatient care, community rehab, and repatriation, all that kind of stuff. But if we're going to start trying to discuss recreation, it's like, well, I can speak as a physio, but the actual recreation, I have nothing to do with that. I can't inform that topic at all, really. But that doesn't mean there are not physios that do, right? It doesn't have to be a physio. And I guess that's what I'm saying. Like, we have to, not worry so much about what my professional title is, and think about, do I have the experience to fill that gap? Maybe there's a researcher presenting with someone with lived experience, and that particular presentation really resonates with a clinician. Well, so they view that and they think, yeah, I'd like to follow up with so-and-so because it really sounds like they understand what I need to talk about or what I need to consult on. Then they can do that, right? We ask most of our presenters to also include their contact information, and people are usually happy to do that. Part of my job is to create resources, review resources, connect people to resources. At the end of the day, we have a ton of resources, almost like it's overwhelming, right? It's like trying to decide what to watch on Netflix. It's like I can't decide when you give me a million choices. It can be overwhelming. It's like I don't even know where to start. And I think for clinicians, that's kind of where we're at now, like within Alberta Health Services and even beyond, right? We have online lots of stuff, but where to go to find it can be a challenge. Knowing that this is the right one or the best one, I think, is another challenge. And I think when you start to look outside the organization, because of course, therapists can look wherever they want, that doesn't end, right? It becomes even more overwhelming. So yeah, part of this is helping to kind of focus that field a little bit, give a little bit more direction. And I think just being mindful, like as we either create or highlight resources, just trying to stay considerate that it's not always great to just keep piling and adding more. Like we also need to kind of focus and think about like navigation, I guess, right? How are
Yeah.
people going to wade through this information and actually find what they are looking for?